Hello friends, this is Sudharshan, and in this episode we will talk about the remaining eyelid conditions, that is the part 3 of this chapter, that is Distichiasis, Trichiasis, Ectropion and Entropion. So Distichiasis as such, it's a condition where we see an extra row of cilia in the meibomian glands and there will be misdirection of the ciliary movement against conjunctiva and cornea. So the treatment will be to do an epilation using cautery or cryo. And trichiasis, so the difference here between the trichiasis and distichiasis. Trichiasis is an inflammatory condition that happens. So because of any infective condition of the eye we can think of, like a trachoma or a conjunctivitis or hordeolum or chalazion. These are some of the reasons we can have. So foreign body sensation will be seen along with reflex blepharospasm also, and it can lead to an exposure keratitis leading to conjunctivitis and corneal ulcer. Treatment will be epilation, surgery along with cryotherapy. Ectropion. So in the ectropion we have the etiological classification with the clinical features we will see. So first type is senile, where the orbicularis oculi muscle undergoes laxity. So we can do a lazy or a operation. Spastic is because of the sustained contractions of orbicularis oculi. The treatment will be to inject botulinum toxin to control the muscle contraction. Then cicatricial, that is a scar or a fibrosis in the lids. That is because of mostly a injury, because of which ulcers and laceration of the eyelid tissue will happen. The treatment will be to excise the tissue or do a VY operation. Mechanically, lid tumors are responsible and the treatment is surgery. And paralytic, mostly ophthalmos or a Bell's palsy or a head injury, and treatment will be the tarsorrhaphy or the sling operation. And congenitally, because of the eyelid skin deficiency it happens, and treatment will be the surgical correction. So the regular foreign body will be seen. We can see the lid margin outwards. 3 grades are present here. So grade 1, eversion of the punctum, and grade 2, along with the punctum, the lid margin and the palpebral conjunctiva will be seen. In 3rd grade we can also have the fornix. And last but not the least, about entropion. Entropion is the inward folding of the lids. Ectropion is the outward folding of the lids. So what are the types here? First is congenital, where the retractor aponeurosis is not developed properly. The treatment will be to reconstruct the lid margin. Cicatricial, as I told before, there will be a scar here, mostly in the palpebral conjunctiva. Some conditions like a trachoma or a conjunctivitis may be resulting in it. So treatment, we can do a Burroughs operation or of orbicularis oculi muscle. And then spastic type, where there is sustained contraction of the orbicularis oculi muscle, we can inject botulinum toxin. Then senile type, which is seen in old age, where the CP fascia, not the clavipectoral fascia, capsulopalpebral fascia, which will be seen. So to reflect that CP fascia, we need to do a Wheeler's operation or a double breasting of the orbicularis oculi muscle, or a lid retraction, or to tuck the lid in this. And mechanical will be the lid tumors and the treatment will be surgery. Complications, mostly exposure keratitis, foreign body sensation will be seen. And apart from that, there are 3 grades in the entropion. So there will be grade 1, where the posterior lid border is enrolled, and grade 2, the intermarginal strip will be visible, and grade 3 is where the anterior border will be turned. So that is all about the part 3 and the eyelids chapter. So thank you so much. We will see in the next.